Good evening. It's a pleasure and an honor to be here in Portugal. I love this country, and I would like to speak in Portuguese, but I will speak in English. So I ask your forgiveness. Me desculpem, perdão. We don't have any specific data concerning patients with Alpha-1 antitrypsin deficiency and sleep disturbance. I talked to my colleagues, and maybe we would now try to take this data and try to see what are the specific problems that people with Alpha-1 antitrypsin deficiency and sleep problems they have. So, among our patients in Israel, we realized that many of them suffer from obstructive sleep apnea. That's something logical, because they have also more emphysema. And they complain, more correctly, they don't complain, but they suffer from insomnia. It's difficult to them to fall asleep. It's difficult for them to keep sleeping during the night. So I will try today to focus on obstructive sleep apnea. That means that you stop breathing when you are sleeping, and it can be mild, moderate, or severe. That means, may I have a... Three. Okay. Oh, it's wrong. Sleep apnea, that means you stop breathing more than 5 times an hour, can be mild, until 15 times an hour per hour, moderate, more than 15 times, and severe, more than 30 times. So I had a patient that stopped breathing more than 60 times every hour, and that's not good. Okay? Because when he stopped breathing, the oxygen in blood, the O2 saturation, lowered to less than 80%. That's not good. The question is, what to do? He was overweighted, and I told him, please lose weight. He told me, doctor, it's very difficult. I told him, do exercise, and he told me, doctor, it's difficult. So I sent him to the ear, nose, and throat doctor and asked him, maybe you have something anatomical, maybe something that our friend, the ear, nose, and throat doctor, the surgeon, can help you. But that was not the case. So we have to treat him. And we can give him the CPAP or the BiPAP. The CPAP is continuous pressure airway device. The BiPAP is the bilevel airway pressure device, something that pushes the air into the airways of these people who are suffering from sleep apnea. When they stop breathing by night, they won't stop breathing because the CPAP will push the air and they will keep breathing. But the question is, why to treat? There is a problem, but why to treat? Not everything we need to treat. We have to treat, we need to treat, because otherwise, more and more people will complain of tiredness. They will lose concentration. They will have lapse in memory. They will complain about arrhythmias. It can increase the insulin resistance, and it can also cause more car accidents, because people are tired. We drive and they are tired. They can have more car accidents. Also, the reflexes are slower, and that can cause more car accidents. Also, we have many works showing that people with sleep apnea can have an increased risk of stroke or of CVA. And also people having a sleep apnea, many of them also are snoring a lot. And if they're not just snoring, they really stop breathing. They stop breathing. So if they have a partner, the partner will complain about the snoring, or will complain that they are really worried. They're scared because the partner is stop breathing. So if you treat them, you have more peace, or as we say in Hebrew, shalom. So it's very good also. Always shalom is good. For people with sleep apnea, we can also give a dental device. Those with a mild sleep apnea and a moderate sleep apnea, according to the American Sleep Society, not the severe. The dental device will help to push the jaw, so when there's going to be a relaxation of the muscles and the airways will be less patent because of the tonus, the dental device will help them to keep the airway open, and they won't stop breathing, but it's not for anyone. Not everyone who complains about tiredness during the day, they suffer from sleep apnea. Many of them go to the sleep lab, and we see that the sleep lab is normal, but they are still tired. What's the problem? They have insomnia. They cannot sleep, or it's difficult to them to keep sleeping, or they're awake early in the morning. We can divide insomnia into acute insomnia, less than 3 weeks, and chronic insomnia, more than 3 weeks. And primary insomnia, the main problem is the insomnia. And secondary insomnia, when the insomnia is secondary to another disease. So people stop sleeping. There can be many causes to the insomnia. It can be something medical, a problem, like pain, like inflammatory disease, like a severe emphysema, other causes. It can be mental, secondary to depression, to anxiety. It can be secondary to medications, especially when we are talking to our patients. We see it a lot when they use prednisone, systemic steroids, especially if they take the steroids by night, okay? So they will have more insomnia. Inadequate sleep hygiene, that means that they don't go to sleep every time at the same hour, then they're not going to be awake at the same hour. They use their room not just to sleep, they use the room to work, they use the room to eat. That's a bad sleep hygiene. There is idiopathic insomnia and other causes that we will try to talk. We are talking about insomnia, but the question is, how many hours we need to sleep every night? Okay, normally, most of us need to sleep between 7 and 8 hours at night. But we have 5% of the population who are what we call the short sleepers. And 5% are the long sleepers. That means that since they were teenagers, the short sleepers, they need just to sleep 4-5 hours every night. And they are not sick, they are not tired, they don't have any problem. They're fine. Give them 5 hours, 4 hours of sleep, it's fine. They're the short sleepers. In the medical school, we used to call them the surgeons. And we have the long sleepers. The long sleepers, they need to sleep more than 9 hours a day. They are not sick. They don't have any problem, but they just need to sleep 9 hours. Give them 8 hours. It won't be enough. But if you give them 9 hours, wonderful, and there is no problem. But what about 90% of the population? They need to sleep between 7 and 8 hours a day. And if they sleep less than 6 hours a day, they have insomnia. And that's not good, because nowadays we have many works proving that people with insomnia, people who sleep less than 6 hours a day for a long time, they have more diseases, and even they have an increase in mortality. So it's strongly recommended to sleep more than 6 hours a day for 90% of the population. Insomnia can cause an increase in insulin resistance. Insomnia can cause an increase in mortality. We have a problem. What to do? Because we have sleep pills, but people, most of them, they don't like to use sleep pills. The choice between to sleep with pills or not to sleep without pills. What to do? But we don't have only medications. We can try to do other things to help people sleeping. We can recommend them to do the sleep hygiene that I talked to you, and we can send them to cognitive behavioral therapy. Absolutely. Sleep hygiene, I talked to you what to do, good habits of sleeping. CBT, cognitive behavioral therapy, it's very, very good as medications in many, many cases. What's the problem? The problem is the health basket. The problem is the national insurance, the reimbursement. At least in Israel, we don't have reimbursement for those people going to cognitive behavioral therapy. So most of my patients in the public hospital, I can't send them to the CBT. But if there is those options in your country, I think it's a good idea. Try. Sleep pills, benzodiazepines, all drugs with many, many side effects and can cause addiction. People are afraid, doctors also. What about melatonin? Melatonin is a good option, but for those more than 60 years old. Why? I'll explain later. We have also the non-benzodiazepine, the new drugs, the new sleep drugs, not so new, but they're not the benzodiazepines, they are more specific, with less side effects, and you have no addiction. We are in Portugal, but very close to us, we have Spain. And in Spain, in Greece, and other South European countries, people use to do the siesta. What's the siesta? They go to sleep after lunch for 1 hour. The siesta is a good option. Yeah, it's a very, very good option for those not suffering from insomnia. And what is a good option? Because it's a bombshell of energy. People who are able to sleep after lunch for 1 hour, for many reasons, they do a complete sleep cycle with REM phase, with is the dream phase, everything, and they came very, very energetic because they have a rapid transformation of adenosine into ATP. But it's not for patients with insomnia. If they will sleep after lunch, they won't be able to sleep in a good manner by night. So, good for some people, not for insomniacs. What about melatonin? Okay. Melatonin, we told, is good, but for older people. Melatonin is what we call the sleep hormone. It increases by night and helps us to sleep, and decreases into the morning, and then we are awake. As the people get older, many of them produce less melatonin, as you can see here. A young one, the levels of melatonin, and an old one with less melatonin. And this can disrupt the sleep and cause people to be with insomnia. So in older people, there is an option to give melatonin. In Israel, we prefer to give the prolonged release melatonin, 2 milligrams a day. But we have to give the patients the information. It will take time until it works. Many patients start using it, and they want results. If you are starting it or your doctor is giving you, you must know it will take almost 1.5 months until you feel that it really is helping you. When it works, it works. So we told that we have a new generation of sleep pills. We told that insomnia can cause an increase in morbidity and mortality, but still people, they don't treat the insomnia. They don't want to treat their problem. They're like the fool in the card, in the tarot card, that they are just walking and they are gonna fall. We have this little dog here that is trying to increase the awareness of this man, of the danger that it's coming, but he's the fool. He doesn't want to come back. I call this dog the doctor with a G. People are afraid of benzodiazepines. Yeah, they are afraid of benzodiazepines, and I agree with them, because there are many side effects, from addiction to hangover, falls, amnesia, very, very, very problematic. And if we can use other family of drugs, I prefer to use other family of drugs. We have also, from the new class of drugs, the Z drugs, we have the zolpidem of the slow release, the continuous release, zolpidem, that is very good for those who awake in the middle of the night, because it helps you to sleep and it helps you to keep sleeping during the night. The Z drugs are better than the benzodiazepines. They have no dependence, no tolerance, and less side effects. Sometimes, for some people, we can say better together. I ask forgiveness from the British and the Scottish here. I'm not doing politics here, God forbid. Just better together. I'm talking about the pills, okay? No monotherapy. For example, people with anxiety that need the Cipralex, they will take the Cipralex in the morning, and the zolpidem continuous release by night. That's a good choice, okay? It will keep them awake in the morning and help them to sleep by night. What about side effects of the new drugs? We do have side effects. We are talking about anxiety. We are talking about somnolence. We are talking about headache. Of course, most of the patients, they won't complain about it, but we can expect in some patients these side effects. Good partners are the benzodiazepines and prolonged-release melatonin, Cipralex and Z drugs. Less reasonable is to give a Z drug together with a benzodiazepine, because they work at the same site in the GABA receptors. So there is no so logic to give them together. So I ask again, what's better? To sleep, not to sleep without pills, and you have a high risk to disease. You are going to be sleepy during the day. You have a worse quality of life. You decrease your life expectancy, or to sleep with pills that will help you to fall asleep. Now, the new drugs, they have less side effects and a low risk of addiction. So I think my answer is to sleep with pills is better. I just want to say thank you again to Guni, to the organization, and to everyone here that it's helping us. And muito obrigado, boa noite, durmam bem, and sleep well. Durmam bem, in Portuguese is sleep well. I really want everybody to sleep well. Thank you very much.